Now we move on to medical language terminology for cardiovascular disorders. The aneurysm. The aneurysm is a weakness of the blood vessel wall. The blood vessel wall balloons out and more prone to rupture. This is a normal aorta. The aorta with a large abdominal aneurysm. Blood vessel wall balloons out and becomes the oval shape, and it can rupture in heavy bleeding results. Abdominal aortas are more prone to get aneurysm because at the place of it's dividing into the right and the left. Common iliac arteries, the pressure inside the abdominal aortas increases and aneurysm occurs. So the aneurysm is a localized abdominal dilation of blood vessel, and usually happens in the artery due to the weakness of the vessel walls, and eventually post rupture and heavy bleeding ensues. And if the aneurysm happens in the brain tissue, the cerebral tissue, the heavy bleeding can lead to the cerebrovascular accident or stroke. And if the bleeding happens in the abdominal aneurysm, the bleeding happens retroperitoneally and can perforate peritoneum, and internal bleeding can occur. Angina pectoris. Angina means pain, and pectoris means chest, thoracic bones. The angina pectoris is a chief complaint of the patient suffering from the coronary artery disease or the myocardial infarction. If the symptoms last just a few minutes and disappear, the angina pectoris may be a symptom of ischemia of the heart muscle. And if the symptoms last longer, 15 minutes or 20 minutes, myocardial infarction may be the diagnosis, and the patient needs medical attention to reestablish the blood flow for the coronary artery. The patient complains of angina pectoris usually they complain of a feeling of confusion around the heart or pain. The pain may radiate to left shoulder, left arm, or the lower jaw. And the symptoms are usually brought on by exertion and disappear when the patient takes a rest. Cause of angina pectoris is insufficient blood supply to the heart, shortage of blood supply to the heart muscle, especially for the left ventricle, because the left ventricle contracts forcefully, so it requires more oxygen and more blood supply for it to work properly. Arrhythmia. Arrhythmia is an irregularity in the heart rate or in the rhythm of the heartbeat. Arrhythmia is another term, had the same meaning as arrhythmia. Arteriosclerosis. Arterial is a small artery, and sclerosis is a hardening. So arteriosclerosis is a hardening of the artery or small artery arterioles. And hypercholesterolemia or hyperlipidemia, dyslipidemia, a risk factor for forming development of arteriosclerosis. The patients with a high risk factor of arteriosclerosis in develop aneurysm. Risk factors include smoking cigarette, hyperlipidemia, hypercholesterolemia, Asian population, diabetes mellitus, bad eating habit, consuming too much fast food, saturated fat. So arteriosclerosis is a hardening of the arteries, and the arteries lose capacity and lose of elasticity, Because there is a deposit of plastic tissue inside the arterial wounds and deposit of calcium salts and scar tissue formation develop. So arteriosclerosis is a risk factor for aneurysm and myocardial infarction as well as myocardial ischemia. Atherosclerosis. Athero means rules or porridge. There's a black and attaches the innermost layers of the blood vessel endothelium. So it will narrow the lumens of the blood flow and limits the blood supply downstream and can lead to myocardial infarction, myocardial ischemia. Atherosclerosis is a development of palsy fibers, patches, and plaques in the lining of arteries and narrowing the ligaments and hardening the blood vessel wall. And atherosclerosis is a systemic disease. It can occur in any kind of the artery in the body. And the most common form of the atherosclerosis is a hardening of the arteries. Atherosclerosis can lead to arteriosclerosis. They are interrelated to each other, and arteriosclerosis is a cause of sudden death, cerebrovascular accident, or myocardial infarction in the human beings.